two surgeries and all that radiation. I said, if he finds something today, I'm really in trouble. So I showed up and he wasn't there, and I asked where he was, and they had said that he had died a month ago, and I was shocked and devastated. And at that time, the family hadn't shared what happened, and I fell apart. And they did find something else that day, so I needed another biopsy, and that wasn't cancer. But in the meantime, I had been concerned about physician well-being. And I was trying to find an inroads to work with my local healthcare system. And after this happened, it's just felt like a calling to me. I just feel I can't explain it any other way, like that I'm feel called to support physicians, and that's what I'm doing.
Hello, everyone. Welcome back to the channel, or welcome to the channel if you are new here. We have an amazing guest with us today. She quickly became a fast friend. She has fiercely taken the stage as an incredible physician advocate and told so many physician stories that I can't wait for her to tell her own story here for us today. So, Kim Downey, welcome to the channel.
Thank you, Jillian. I really appreciate you having me.
And for the people who haven't yet had the incredible opportunity to meet you, can you please tell us more about yourself?
Sure. So, by training, I'm a physical therapist, and most of my work has been with pediatrics. And I was working at a local elementary school. And in the fall of 2020, I had surgery for thyroid cancer, and three of my parathyroids were inadvertently removed during the surgery, and the fourth one never kicked in, and that caused a series of complications with calcium regulation and kidney function. And I was referred to a nephrologist, and so there were some more complications besides that. And then the following summer, I blacked out and fell and hit my head. And in retrospect, the doctor thinks it was low calcium that caused the cardiac arrhythmia. And over the next couple months, I was diagnosed with Lyme disease, a concussion, thoracic outlet syndrome, a whiplash injury, and a broken toe. So I had a great physical therapist. In between him and my doctors, they had figured all that out. And I had 4 months of physical therapy, and he had me in good shape by December 29th, 2021. But the very next day I was back on the operating table because we had just found out that I had breast cancer. So I had surgery for that, and of course the radiation. And then I had to go back for another MRI because there had been an initial finding on either side that she couldn't see the day of the MRI biopsy. So I had that MRI, and unfortunately that was cancer as well. So then I needed more surgery and another course of radiation. And I don't know how much we want to get in to the details, but I had this incredible radiologist who both times happened to perform, like, I say, miraculous feats of technical skill on me. Like, each interaction was unusual. Like, the first time he said it was the most difficult mag seed placement he had done in his 30 years as a breast radiologist. And then the second time he got the magnetic clip to pierce the metal one, which is like radiology Olympics. So he was just amazing. So after 2 years of like constant, medical issues, a year ago, October 4th, I showed up I told my husband, I said it was supposed to be a routine mammogram and ultrasound finally, after all these findings and the three cancers. And I showed up, and I told my husband, I said, I says, hopefully he's not going to find anything today. And I said it tongue in cheek. I says, I just had, two surgeries and all that radiation. I said, if he finds something today, I'm really in trouble. So I showed up, and he wasn't there. And I asked where he was, and they had said that he had died a month ago. And I was shocked and devastated. And at that time, the family hadn't shared what happened, and I fell apart. And they did find something else that day, so I needed another biopsy, and that wasn't cancer. But in the meantime, I had been concerned about physician well-being. And I was trying to find an inroads to work with my local healthcare system. And after this happened, it's just felt like a calling to me. I just feel I can't explain it any other way, like that I'm feel called to support physicians, and that's what I'm doing.
And you quickly went through your journey, and it's something that I can't imagine, when it comes to taking care of patients, like the opportunity to hear What did you need along the way? What was most supportive while you were going through all those things?
Well, it was, of course, extra difficult because all 3 times was during the pandemic, right?
Mm.
So I answered the COVID questions 100 times. I had my temperature taken 100 times because of the kidney issues. I had blood work like a lot, literally 100 times. And it was really, and then, because you'd show up and they'd say, you'd have to answer all those questions, if you left the country. And I'm like, no, I haven't even barely left my house, right? It's like
Mm.
all I'm going is to the doctor's office, and you wanted to like yell at them, but it's that they had to ask the questions. But I'm involved with my church, and we have this women's fellowship group because again, we were all kind of siloed and isolated, right? Even because of the pandemic, and I had to be super careful because of all these doctor appointments. So for 2 or 3 years, like I didn't really go to restaurants. I didn't, do much at all. I was super careful. But when the pandemic hit, we switched to Zoom because we used to meet in person every Saturday morning. And that was one thing, because we've talked about, you and I, sense of community, right?
Mhm.
And that was a stable for like no matter what every week, because it was just like that. It was like something else was every week. And I'm like, oh my gosh, you guys aren't going to believe this or that. And then they share things as well. So we support each other. So just to have that no matter what, they were there to listen to anything I had to tell them. And that was one group. And I did get involved with Ann's Place, our local cancer support center. So that first center, I was first summer, I was able to talk to a social worker, for the summer, and that was really helpful as well. And then even like somebody from our women's fellowship group who's really smart, and she would tell me about books like I think like Alan Watts, The Wisdom of Insecurity, or Clarity by Jamie Smart. And then she even came over one day, like I had read it and dog-eared pages and taken notes, and we sat and had like an academic discussion about it.
Mm.
So people just showed up in my life when I really needed them, or somebody at the grocery store when like from church. A lot of people, it was from church, and it should say, somebody saw me in the parking lot and said, how are you doing? And you say the pat, oh, I'm fine. And then she's like, no, how are you really doing? And then that opened a door. So when people really say that, and that people care, and I have a lot of friends and relatives in my life that were supportive, and that was helpful.
Wow. Wow. I, to know you and then to hear your story, it's your shining light for so many. And we were talking before when we're on your channel, just like the fierce advocacy and this groundedness and this why that you have, it shows up in your passion. So thank you for sharing some of your background and also helping us to understand what fuels your why. And we can go a little bit more into that article that you wrote on that radiologist, if that would be okay with you.
Sure.
So the article, as you've now prolifically been, I know you and Kevin Poe are probably pretty close now. Dr. Kevin Poe, shout out to him. I think he's
Yeah,
been
exactly. Right.
just the tremendous amount of community development he's created through his blogs. You're talking about the importance of community, because that's how we got to know each other. You were having an idea to share this article on his platform. And the article that I'm referring to is called An Inspiring Tribute to an Exceptional Radiologist Who Made a Lasting Impact. You shared a little bit about him, but what else would you like to share from that article?
Well, uh, it was like the day I met him, just that while I was having, like a difficult time, because I had never had surgery for breast cancer before. And I was scared. It was like, December 29th, I wanted to be home with my family. And he had me take, because the finding had been so small, it was an MRI finding only. So I didn't realize the Herculean task he was faced with, because we only had a mammogram and ultrasound. There had been no plan for an MRI that day, but it only been seen by MRI, and the metal clip had gotten displaced when she took the biopsy. So how was he supposed to, know where to put the magnetic clip? So I didn't even realize at the time because I'm not thinking because I'd never done this before. And he tried so hard. So even before I met him, he had the radiology tech. I did like 15 mammogram images. He had me, like, go to the left, go to the right, fall forward into the machine. And she's like, trust me, you're in great hands with this radiologist. So he tried everything. And after literally, I think 15 images, she said, he wants you to come across the hall. He's going to try to find it by ultrasound. And that was when I met him. And since this was taking so long, we just had a little bit of a conversation. And then he's like, I think I found it, and so he had to bring the equipment over to do the biopsy. And later, my breast surgeon said that it was like looking for a needle in a haystack, and that he couldn't have seen. He said it was so small, he couldn't have seen the cancer. That he had to see the where the tissue looked different from when it was displaced when the biopsy was taken. So he was that good, but he got it exactly, where he needed it to be. So I was so grateful because I fully understand that it's hard to expect for clear margins in a situation like that, and that the two of them worked as a team to do that for me. So I was really grateful, and I sent them thank you notes. And then even when we were done, he was just chatting a little, and that's when we found out we had worked at the same hospital at the same time back in 1989. He was a resident, and I was a physical therapist there. So, and then he handed me his business card. So he didn't have to take the time to try to get to know me as a person, but he did. And if he hadn't given me that business card, I wouldn't have reached out. But then when I knew I needed another MRI and that he had done such a good job, I called the number, and by then there's like a few places where my breast surgeon works that you can have the imaging done, and they had moved him from one place to another. So they gave me the forwarding number, but they accidentally gave me the number to his reading room. So when I called,
Oh.
he answered the phone himself. And I was like, is this not just for
Oh.
Lhasa? And he's like, yeah, who is this? I'm reading images. So I'm like, I'm so sorry. And then I explained what happened. And he's like, no, that's okay. And he stopped what he was doing, and he looked me up because he wouldn't have known or remembered that there had been a finding on the other side too. And I says, I need another MRI. I want you to be the one to read it. So then he said, absolutely, and then he connected me. And then that day that I went, the day that ended up being the last time I saw him, when I showed up, he just stood in the door and tipped his head because he knew this was like my third round of cancer in like a year and a half. And, and he just said my name, and I says, I don't want to do all this all over again, already. And he's like, you need a hug. And he came over and he gave me a hug. And then after, like I said, he got the magnetic clip to pierce the metal one, and he was shocked himself. So he called me over to see. He's like, I can't. He looked at it and from different angles. He's like, I can't believe I just did this. And then later, our my breast surgeon had said it was like threading a needle when you can't even see the needle. And he said it takes a lot for a radiologist to impress him, but that impressed him. So I had sent them another round of thank you notes. And then he actually called. I was at the beach to thank me for my thank you note. And that was, and at the end he said, I'm sorry you're going through all this, but I'm looking forward to seeing you again. And I told him I was looking forward to seeing him too. So that was the last time I spoke with him over the summer.
It's showing the humanity, right? The connection that you shared, and it's powerful. The skills alone, but also, there's skilled radiologists, skilled physicians, and
Mhm.
oftentimes the concern is, well, neither the patient or the physician feels like they can be human.
Mhm.
And to maintain the capacity to show up for you and for you to show up for him and be fully human is what really stands out.
Right, for both of us, because
Mhm.
I have some doctors that manage to do that, and it's incredible. And I'd say that I've had some wonderful doctor visits, and one when I walked out, I was like, wow, that was I'll say darn here, but I'm like, wow, that was a darn good doctor visit. Like it was like just powerful and moving. And I've had some like that. And again, I'm not Pollyanna, and they haven't all been good because I've actually, we won't focus on those, but I've had some that were perceived as traumatic. So I've had
Mm.
some horrible experiences in the last couple years as well. But I'm focusing on the good ones, and also knowing that the physicians whom which I had a poor experience, that who knows, maybe they're hanging on by a thread.
And it goes both ways, right? Because sometimes we have a difficult patient encounter and we're like, oh, I don't know why that patient showed up that way. We'll be curious and understand, well, what's going on in that patient's like free cancers. Like I can have a hinder of like, okay, well, definitely you've navigated it quite a bit. Like you've speak now for both. You've been well integrated into the medicine forward community, into our big physician community or one of the pack. You've seen both sides of it. So if we're to explore recommendations from both a patient perspective and a physician perspective in this scenario, speaking to patients showing up for physicians, what can that look like when you're going into a visit?
What from a patient perspective.
Yeah.
So it's good if you show up. So one thing that I did is obviously all of this, because I'm only scratching the surface of the things that actually happened. So my medical record got so complicated, and now my stuff is in several different systems. Like the breast surgeon, that's one whole system. Most of my doctors are in another system, but my medical oncologist is at Yale, and the systems don't talk to each other. So
Mm.
when I switched primary care doctors, I wrote out, I just decided, well, I'm going to tell this guy in bullet points, like what's happened, because otherwise it would be overwhelming, right? Because I've
Yeah.
never met him before. And all of a sudden, everything's so complicated. So he thanked me, and then I had switched. I had a new gynecologist as well. And before I even walked into the exam room, he had thanked me. He goes, "Thank you so much for this. It was so helpful." And then when he came into the exam room, he thanked me again, and he said every patient should do that.
Yeah.
So you can't expect, because doctors have caseloads of like what, 2 to 4 thousand people. Have no idea, right? They're not going to remember every single thing about you. It's like literally impossible, right? Unless you're Rain Man, maybe, right? I don't know.
Yeah.
But
Yeah.
so if patients can show up with like just like a bullet list, and then have their medications, right? Because sometimes they say, like I've heard doctors, they'll say, oh yeah, I take a little white pill, right? It's
Yeah.
like what? And so if they can come prepared, and then also show up with kindness. And I have a friend who was needed to go to an urgent care when she was in Florida, I think in February, and she didn't have a very good experience. But because of the things that I've shared with her, she was able to think to herself, well, maybe that doctor's having a really bad day.
Mm.
And instead of, like going around and complaining or writing a bad review, she was able to find some compassion for the physician herself. So to just know that they're doing the best they can. We all are, right? Unless you're a psychopath, right?
Yeah, that's a whole different talk. Yeah, I like the idea of putting together being your own self advocate and you understand the system. Both, you have experience being a clinician and also from physical therapy and knowing like the documentation is so
Right,
far
right,
away. I agree with that. And also when patients say the medications are in my chart, well, there's a whole bunch of medications in your
right.
chart oftentimes, and which ones are you actually taking?
Right, because
And
sometimes they never leave, like, even, like, a
yeah,
colonoscopy prep, right? Like,
yeah.
it'll
I
show
hope you
up and it's
stop
like,
that.
that's not like I don't do that every week.
Yeah, no, that's such an important recommendation. Thank you for sharing that. And then, from your perspective, being a physical therapist and working with physicians, how do you feel that they can best show up for the patients?
Listening is very, very important. And even if I think of like the I've had 4 procedures where I had to go under anesthesia, and 2 of them, and I don't do great with anesthesia. So each time, like I would explain, and actually one didn't even initially say, "Do you have any questions for me?" Or, is there anything you want to tell me? Or do you have any questions? And I think that's so important. So I had to share myself. I said, look, I just wanted to tell you these, some of these things, because you want them to take it into consideration, right? And then maybe if they know that, they can do something so you might be less dizzy and nauseous when you wake up. So one of them, the first one, just before I had the cancers, it was a different procedure, and he was so nice, and he even said that, what did you want me to know? And then he goes and out, once I told him, he's like, I'll take that into consideration. And then he said things like, I'll be with you the whole time. And it's like, I didn't think you'd leave, but then I also didn't know about the nurse anesthesiologist. I didn't know now that these days it's not, the anesthesiologist doesn't often stay with you, but he was with me the whole time, and I just felt safe. I felt like he listened to me, and I felt safe. Then the next surgery I had, I felt like that guy, that was the one where I said, there's some things I want to tell you, because he didn't even ask. And then he didn't really acknowledge it. And then I was really dizzy, and maybe there's nothing he could have done differently, but even if he just would have acknowledged, like, I hear you, and I'll do the best we can, or we have to do this amount of medication, or just something, so that I know that he heard me, that he was listening.
Mm.
And then the next time, I had another really good one. And there was the same thing. And he goes, well, I'll do this and that. Like, he was thinking out loud the little things that he could, or, do differently. And that was the best I ever did with anesthesia. So really, I'd say it's listening, showing up with your present self, if you can.
Yeah, well, I find that in oral surgery, I think it was led probably by my program director, because I just went back to this program, and I heard him say this to his patients. At the end of it, he said, "What questions do you have for me?" Always,
Mhm.
it's so behavioral that it's what questions do you have for me?
Right. Yes.
And they always ask the questions. And our when I was an intern, our chiefs always got it, so I think they got it from him, because
Mhm. Yep, yep.
it passed on. So it becomes just part of what you expect yourself to say at the end of each
Yeah,
appointment.
right, yep, yep. No, I think that's really important as well, yes. I
It,
agree.
yeah,
And
and I'm
actually, and even the wording, the way you said, because I read this somewhere and I can't remember where. Instead, because if you say, "Do you have any questions for me?" the patient is often likely to say no. But if you say, "What questions do you have for me?" that opens the door a little more. Like, okay, they're actually expecting me to have questions, and then you more feel like you can share what
Mhm.
really your questions are, where you might feel like, oh, my question might not be important enough, just that wording, just changing from "do you have any questions" to "what questions do you have for me," I think is.
Yeah, isn't it interesting? It's changing from a yes no response to a more open
Mhm.
ended. And there's the book Humble Inquiry that we talked about on your
Mhm.
channel.
Uh-huh.
I was just rereading it because I recommended to somebody who got it, and I'm like, I'm going to keep rereading it because I keep
Okay.
recommending it. It talked about healthcare, and when we don't listen, we're quick to diagnose and create treatment plans that may actually be off of different diagnosis and what's really going on. And to spend the extra time up front can save time and increase patient safety long term. And
Mhm.
it's our systems pressuring us so much, and we can't fall
Right.
for that. We have to
Right.
stick with what we know is true, which is, and it doesn't necessarily need to take a whole lot of time. It's creating that space to pause, to step back and ask, right? Because
Right.
we just said it takes less time once you hear the patient and understand, oh, I was about to treat the wrong problem or miss something that could prevent
Right.
a lot of adverse
Right.
outcomes.
Exactly, and I really appreciated that my new, because I had to switch a few physicians, but the ones that I have now really do listen to me, and I tell them how much I appreciate that. And even to be diagnosed with Lyme disease, it had to be, I was tested 3 times before. So it was like when I went back the third time, because it was for a follow-up, and I was like, like, and I listed some or something like that, and he looked at the numbers and he's like, I think we should do this again. And so just the fact that he really listened to me, because like I'd only typically gone to a doctor, like, once a year, each of them, right? A primary care doctor for a checkup, and the gynecologist. And then all of a sudden, like, when this guy met me, all these things were wrong, and I was like, oh my gosh, he's gonna think I'm a hypochondriac, or I have like
Mm.
Munchausen syndrome or something like that, because I'm like,
Yeah.
so I even said, really, I'm not usually like this. I'm like, but that I've told him more than once, that I appreciated that every time he took me seriously. And then that's how, they figured out the things that were wrong. And he did a good job sending me to the specialist he thought he should send me to rule some other things out.
I love it. And you being an advocate and knowing It's interesting. Yeah. And I find that sometimes we don't report symptoms, and someone was just asking if I have chronic pain. Right. And
Mhm.
I under talk about it because it's, how patients, especially females, can be perceived when we're reporting pain. Sometimes it's not taken seriously. And I'm treated for it at the VA. Like it's been a problem that was identified a long time ago. And it's like very clearly well documented and like
Right.
substantiated, but not always has to be, but substantiated by physical
Mhm.
findings as well. But
Right.
I was like, oh yeah, I started minimizing that because we're in healthcare
Mhm.
and we know the
Right.
biases sometimes, and not that people have to be in healthcare, they already gone through it. And like, wow, how
Mhm.
are we actually perpetuating that? Some
Right.
people call it medical gaslighting now, or like, oh, I'm
Yes,
actually not
yes.
getting my needs met. But you didn't do that, but I was just thinking, but you are trying to
Mhm.
prevent that from like
Right, right,
preventing.
right.
Yeah. Anyway, it just brought up all these thoughts in my head. I was like, oh
Yeah.
yeah, well, I'm curious, how people show up. And had that person not let me do one more test, or had we
Uh-huh.
say what questions you have and you didn't say anything, how differently things could have been, or the delays in the diagnosis that you
Right,
could have
that
changed.
100%. Like I could have gone on for months if he didn't listen to me or take me seriously. It could have been months, and I, because then I already had ended up needing like 2 rounds of antibiotic because we did it, and then I had some symptoms come back, and again he listened again. He's like, I think that we should do this again, and so I tell him every time I'm going to see him on Monday how much I appreciate him and
Oh,
appreciate the
nice.
fact that he listened to me.
Yeah, it's very helpful. I think that having words of appreciation, like when it's we underestimate the value of those words and
Hmm.
hearing. Like during rough times in when I was an intern in oral surgery, I got a card from a patient after a
Hmm.
pretty big procedure that I
Hmm.
had the opportunity to serve her. And I still have the card because it was so meaningful to
Right.
me. I was like, I just thank you for that card. It meant
Yeah.
so much for me, and it's like you do all the preparation, make sure the patient gets exactly what they need. And
Right.
yeah, and it was so meaningful to have those words, especially when you're not getting those words from yourself, or you're getting a lot
Right.
of different interactions. So I appreciate you modeling that.
Mhm.
Um,
And now I know some of my friends have told me that they've sent their, because that's, I'm now big on sending doctors thank you notes, and it's different than an email. If you get a handwritten, right? Because you can't save it the same way, and whether or not they save it, but just to have that in write, to get something that's just something nice, right, in the mail to open, and it's a thank you and a gratitude. And so some of my friends, because I have a friend, some women are talking that some middle-aged women, especially a little overweight, feel like they're dismissed by physicians.
mm,
And so a number of friends have told me that. And so this one showed up, and she really appreciated that this doctor did take her seriously and something did need to be done. So she wrote her a note that she appreciated that you really listened to me and you didn't, dismiss me.
I
um,
think that's actually where I often hear the most stories about that medical gaslighting. Besides the chronic pain, it's with the weight stigma.
mhm.
And every time someone has a real complaint, then our training is such that it's weight is one of the first things that's taken
Right.
and highly focused on. I, as someone with, a long history of an eating disorder, I don't get weighed, unless I need to for my own eating disorder
Mhm.
treatment, because I know that that will alter the physician's capacity to look at me holistically. So patients need to know they're right if it's not medically necessary to be weighed, if it's impacting their care negatively, that they
Right.
can say no. If they don't feel that they are being seen, that there are better physicians that are more aware of that weight stigma and have more compassion. There's a lot
Right.
of unlearning that needs to be done when it comes to the negative impact of being so highly focused on weight in our
Right.
medical training. It's something that we're more vocal about, but it's got to take a longer time to help people to understand the detriments and why we have to
Right.
unlearn it.
Right. And that's
Mm.
not unusual because I have another friend, and she has a lot of health issues, like real health issues, and she has a problem that's been proven. She was always a runner, and she loved to play soccer and everything. She loves to be active, and she has an issue where she hasn't really been able to walk. And she went to a doctor, for something else, and then the next day they sent or the nurse called and said the message like the doctor, wanted her to walk a couple miles a day, and she's like, I would love to walk a couple miles a day. And actually, just today, she had a procedure that's hopefully going to take care of. And when they even told her, they said, "Oh my gosh, this would have been very hard to live with for a year. You must have had a lot of trouble walking." And she's like, "Yes, thank you." And so to feel, invalidated as a patient, it's the suffering, it's the insult on top of the injury, right?
Yeah. Yeah. I I've heard way too many of those stories and have felt the uh stigma of my own doctor after I came from a pretty emaciated state in the past 2 years to
Right,
health, the current state of being. And because it was a big difference, despite
right,
my
right,
medical
right.
history, my current VA doctor recommended that I go exercise and like healthy diet stuff. I'm like, from clearly was this is documented, like restrictive
Ex-
eating disorder. I was
Right.
mind blown, but it gave me that, you know, I have such huge compassion for people in that state, and for me in the state that I am and the age that I am and the years that I've been navigating how to not allow those comments to create spirals, but how you're sensitive to it, right? It's like, oh,
Right, right,
clearly it made an emotional impact because I'm like, oh yeah, I
right,
see these people. We're going to validate the heck out of them and wish for better and hope for
right.
better and be intentional about being part of the improvements that they experience so that they can feel safe. Because what happens is then people start avoiding going to the doctor at all.
Right, right, exactly. Yeah. Or then you don't tell them things because you don't think they'll believe you anyway, or it has to get really bad, right, before you'll share it or go. Yeah.
Yeah, so we will work on improving that. We'll make sure when we are embarking on these improvements for the physicians that we're constantly being mindful of how we can improve our advocacy for patients as well. I love that you mesh it together. Now,
Mm.
let's share more about what you're doing as an advocate. We'd like to say a fierce advocate. You are a fierce
Oh.
advocate. You have
Thank
your
you.
new YouTube channel, the Stand Up for Physicians YouTube channel. So tell us more about all you're doing.
Sure. So yeah, so the new YouTube channel is called Stand Up for Doctors.
Oh, yeah, sorry.
Because I had the idea that where I wanted to spotlight a lot of physicians so they can help by telling their stories, they can help other physicians. So when I had so the four is in parentheses because when I'm interviewing the physicians, it's stand up doctors, like use your voice, let's hear your stories and let's hear what you have to say. And then I will be interviewing patients at some point as well. Of course, we're all patients from that
Yep.
perspective, and that's what the four is for, that we have to, stand up for doctors as well. So that's how I came up with that title. And I was only going to do one episode a week, but there's over like 60 doctors waiting to be on it. So that's why I'm publishing 2 episodes a week so they don't have to wait so long. And after I have after I've recorded a chunk, maybe if at least a few months of doctors, I'm not sure if I'll like incorporate a patient then, because there's other people. I have such a long list of people who want to be on it and who would be good guests. So I don't know, maybe sometimes I'll pair some people up. I'm not sure, but so that's what I'm doing. And I think they're all great episodes, it's just like wonderful doctors such as yourself, just telling, because you each have such a unique perspective. So I tried to plan the recording to spotlight, what is most meaningful for you and what do you really have to share with the world. And then that's how it comes out. And I love it. It's, each doctor's unique perspective. And then as you mentioned, Medicine Forward, Dr. Todd Otten had just asked me to be the community ambassador for Medicine
Mm.
Forward. So maybe we'll get a little more into that in the new year, because I feel like I want to make changes locally, but also we know that some changes need to be systemic or on a broader level. So I feel like if I can address it from both ends, from, the broader level with Medicine Forward and locally, I'm still trying to find a way to do something that'll positively impact my own physicians. One thing I'm planning on doing is I have this friend who asked me to give, she has Parkinson's and she's in New Jersey, a talk for her Parkinson's group in January. I told her I was interested in something like how to care for your how caring for your doctor gets you better care. So
Mm.
that's giving me a deadline to work on that talk because I wanted to do that locally, either like at our cancer center and or our library. Again, to build up some patient collaborators, like to get, to teach other patients what things are like for doctors these days. And yeah, and then I don't know, maybe getting the community involved to make Doctors Day a big deal or something. So I don't know. So if anybody out there has any suggestions,
Yeah, I think
I'm
you're
open.
doing it. Yeah, you're doing so much. So you've got your YouTube channel, you've got the local work that you're looking into. And I think it's interesting because as you know, I just became a certified chief wellness officer, and each different system within our larger healthcare system has different needs. So
Right.
actually, in order to reach the larger issues, we do kind of need to narrow it down, or else we're going to be
Right.
lost in the sea of complications. So I find that to be a really good strategy.
Hmm.
And then as you see what works in your system, you can let's see where else this applies, right? So let's try it
Right.
here and then see where else it can be scaled. I love that you are teach a person to fish, right? It's kind of like
Hmm.
helping other people to do the similar things and with the mission that it will help themselves. Like help
Hmm.
you, help the
Right.
doctor help you. I love
Right.
that. And tell us more. You've got so many great articles on Kevin MD. Can you kind of share your vision for those?
Sure. So the first ones I kind of took one at a time. The first one was my tribute article to Doctors for Laza, and then I have a wonderful physician coach, as you know, Dr. Michael Hirsch, and that helped me so much. And I knew that some doctors don't yet understand coaching or aren't open to it. So my second article was about that. I just wanted to share, like the benefits of coaching and how much it helped me. And so that was my second article. And then I did one about the struggle is real for patients and doctors. Again, that's related to the talk I'm going to give to let the layperson know. And actually, I'm in a writing group. Well, now I don't have to do the writing group because I'm too busy, writing and doing podcasts. Because each time I go on, I'll say hi. It's like on Thursdays, and I'm like, hi, when I have to leave to do a podcast, all right, I'm writing an article and I have a deadline, so I can't be in the writing group. But anyway, but it was one of the writing teachers that said to me that he suggested I write something for the layperson to understand how difficult things are for doctors. So that's what I just let people know. And then also part of that was a few physicians I quoted them talking about how much thank you notes mean to them. And there was another one in there too. And then I had an idea for to collaborate, and you were part of that first collaboration. And I had an idea because I know that some doctors are struggling and some doctors are finding ways to do well, even in the system as it is. So I wanted to spotlight all different things that doctors are doing to give other doctors messages of hope, right? And then that was what we titled it, a message of hope for physicians. So I spotlighted, three of you that the focus is more on your individual journey, like you had all been burnt out and what you did to help yourselves. And then I did a second one and featured several physicians who had received coaching and then went on to become, coaches themselves, as you did. And then that fills their cup helping, where before they were burnt out trying to leave medicine themselves, now we're still practicing medicine and helping their colleagues. And then the third article was, featured a few physicians who are doing other things, finding the ways that feel that so they're still practicing medicine and they're doing other things. And then the fourth article, because I planned them, to be in this article, is sometimes to save your life, if you have to leave, you have to leave, and that's okay too. And that's what the fourth article was spoke to was physicians who aren't practicing medicine but the things to show doctors other things you could do. Now we need doctors and I need doctors. Like I just saw my nephrologist. I don't remember if I said this on our podcast, but I told him last week, I said, it's not lost on me. If you left and nobody replaced you, I would literally die, because now I'm on medications and somebody that would keep me alive. And so we need doctors. So I don't want them. I want, that's my other, of course, passion for making the health system better is I need doctors, right? For myself. So then after I did those four, then when I would publish those on LinkedIn, other physicians started reaching out to me, being interested in collaborating. So I've done a couple more collaborations since then. And just a podcast I did today, another physician at the end of our podcast said that he'd love to collaborate on an article with me. So we're going to circle back in January.
I can't wait. It's lovely to see you blossom, especially as during our first talk, I shared with you how sometimes taking positions that are stuck within a system can prevent us from doing what we truly are trying to do.
And I didn't want to hear you say that because it sounded more difficult, right? You were saying that maybe I could make more impact if I wasn't stuck within the confines of the system. And I didn't want to hear it because I have no idea what I could do, or I might have been thinking I can't do anything. So I kept, trying to bang on this, little window or door that kept slamming shut while all these other, windows and doors were flying open. And I was trying to like keep my blinders on.
And how relevant is that for many of us, right? Because it's easier sometimes, quote unquote, easier to stay in a known than to take a chance on an unknown. Like there's fear of the unknown. And I find that we can focus, and I'm guilty of this too. Part of what we feel trapped or we feel like we are get kind of when the horses put blinders on, really focused
Right.
in on like this is my vision. And if we're a little bit more risk averse, we might stay within something that's already established. But for
Right.
me, when I was listening to you, like your ideas were very expansile, and I'm like, wow, this you can create this. You're already in your writing group, right? You already have the skills and the vision to make the impact. And how much having our current lifestyle with access to different networks with on LinkedIn and
Mhm.
knowing the people that I'm like, oh, we knew what you're talking about. We can connect. The
Mhm.
irony of me already knowing Michael Hirsch very well. I'm like,
Yeah, I know. I
this,
couldn't believe the very first time I talked to you because his name came up and you already had known him really well. I'm like, oh my gosh,
yeah,
that was such a
is
coincidence, right?
amazing. I love Michael Hirsch. Um and knowing within the weight of the system, for most of us, it creates this weight that suppresses the energy and the creativity, and it has rules and regulations. And if you work for us, you can't be volunteering for them. And if they say you doing that, are you allowed to do that? Like we know that those restrictions can really create physicians are afraid to speak up because they're afraid of how it
Right.
will impact their career. Like most of us that speak up, there's some reason why we've become a little bit more frisky, right? If it's
Right.
because our lives were almost lost, because I mean, me, I lost my military career, like we
Right.
feel some sort of why that you have had that's so fiercely ingrained in you.
Mhm.
And so I'm so grateful that you took the chance
Mhm.
and that I was just posted something about how I'm so thankful that some people say no to us because not all opportunities are really meant for us.
Right. Yeah, right. That's true. Yeah. So, yeah, being willing to say no that the things that don't serve you, right? And be willing to say yes and like you said, feel comfortable, step outside your comfort zone and try something new or different.
Yeah, and the forcing thing. So I'm, a Martha Beck Wayfinder life coach, and I find that I was resistant to her teachings, which you were feeling resistance to. So this is why I bring
Mhm.
it up. Is like I had a job opportunity that I was talking myself into from here because it
Mhm.
was a known, and I was really leaning into it, and was trying to. It felt forceful, like I was trying to control it, and
Right.
if we allow, like we have to allow things, like if you feel that you're trying to convince the people to hire you and they're not seeing your value and fighting for you,
Right.
don't keep, like that is a mindset many of us have and need to shift, where we don't see enough, like I see your value, I saw it
Yes.
right away, right?
Mhm.
And
Mm.
uh how easy is it for me to tell you that? But like, I think I'm, I have low self-value,
Right,
right?
right,
So
right,
I'll
right.
take what I can get.
Yeah, yeah,
But
exactly.
hopefully that's a mindset shift. But many of us don't see our value enough. So then we accept opportunities that actually often oppress us or
Right.
um are kind of self-fulfilling prophecies in saying like, yeah, of course I'm not that valuable, see what they
Mhm.
offered me, or in that scarcity mindset of, well, I have to take any job that I can. And often this is coming down for a few of the things that we brought up today, is like, if we're so exhausted and can't think with expansion, if we are feeling alone, you talked about the importance of community. And so I find that what you're leading and creating is the community and showing people what's possible. We're talking about the things that we've experienced and the steps out, or the ways that we're starting to maneuver. So that was a long-winded way of just saying I really appreciate everything that you shared and how it applies to so many of us.
Right, yeah, thanks. It's,
You wrote.
just like you know, one song, that had come to me for a while was, "I Am Woman" by Helen Reddy, right? And I think of you, wisdom born of pain, right?
Yes. And you wrote down some life lessons that you've gathered along the way. Let's hear what you've got. Let's hear what you've got.
Okay, all right. So a couple things that because yeah, you had shared something early on with your like podcast notes or something like that, and I'm like, I don't know about these life lessons, but when I tried to think of it, a few things that were really big to me that people could, it might impact them in different ways, right? Because everybody's journey is different. But one thing is about radical acceptance. And life is, by its very nature, uncontrollable. We should stop trying to finalize our comfort and security and instead find a radical acceptance of the endless, unpredictable change that is the very essence of this life.
Wow.
And kind of related to that, as far as radical acceptance, because I've had to do some radical acceptance of a couple different things, is related is let go of the idea that things could have happened differently, as if this life is a choose your own adventure book and you simply turn to the wrong page.
Oh my gosh, I like him.
And then another thing is about being in the present moment. And I just recorded a podcast with Dr. Tony Avellino, and he talked about the importance of being in the present moment. So a quote I have related to that is, focus on who you are and what you've built, not who you'd planned on being and what you'd expected to have. Trust that the present moment, however difficult, however different from what you'd imagine, has something to teach you.
Mhm.
And related to that, we shared, I think I shared with him, it was another sentence that helped sometimes was, all is well in this moment. So there's times where if you're running from a bear or if you are in the middle of a traumatic experience, all is not well in this moment. But if it's a lot of stress or other things in this actual moment, you're basically okay. And I learned some of that too from Rick Hansen. He's a psychologist in California, and so sometimes just saying all is well in this moment can bring you back to, your presence and yourself. And then the last thing has to do with transformation, and that transformation happens in the obstacles and how we handle them. So you'd wish that you could just like, transform the easy way, but it happens in the obstacles and how we handle them. And then lastly, related to that, what hurt yesterday will hurt today and tomorrow, but over time, the sharp pain may dull to an ache. Trust that you will learn how to move with the ache, that you will be transformed by it in ways you can't yet imagine.
Oh.
And some of those things I got through this book, Keep Moving by
Oh,
Maggie
I
Smith.
have that book.
Oh, do you?
I
Oh,
was
well, I
gifted that book.
dog-eared like every other page. So I think a lot of these
Ah,
things were actually from that book.
interesting. I was gifted that book by a wonderful physician coach.
Oh, okay.
Nice. Well, thank you. Well, you shared many life lessons. And what are the takeaways from our main discussion today?
Oh boy. Well, maybe those, but basically,
It's
right? If
true.
you're a well, how I end, mine is when I share, my podcast, I say that we all, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. patients need to care about doctors too. And I think that's it, because we're all talking about healthcare and we all need to care about each other.
I love it. That was a fantastic takeaway from our main discussion as well. I do love how you end your podcast like that. And where can people find you?
On LinkedIn. I do have a website. I mean, I could share, it's kimdowney.org. But there's not a lot on it yet. My husband created it for me. So there's just some of the Kevin MD articles there. So not even all of them, and not the podcast. So we have to work on that a little bit. So mostly at this time it would be LinkedIn.
Yeah, I'd
And
say they should
the YouTube channel, Stand Up for Doctors.
love it. They should hang out with us on LinkedIn. They should make
Absolutely.
sure to go to your YouTube channel, subscribe, watch the videos, like, share your comments. Let Kim Downey know how awesome she is and how grateful you are for her wonderful voice. So thank you so much, Kim, for being here.
And thank you, Jillian. I appreciate you so much, probably more than you know.
Oh, I appreciate it.